Hi guys, and welcome to Indirect Pressure. In this video, we're gonna go over the benefits and the cons of indirect pressure and how to use it. So let's jump right in. Okay, let's start with the cons. As we already know, using a tourniquet or indirect pressure basically means that we're completely stopping the blood flow from getting to the injury, and that way we're stopping it from bleeding. Now, when we're stopping the blood flow from reaching the injury, we're, we're completely stopping the blood flow. So we're also stopping it from reaching the cells that need the oxygen. Now, this is important because that means that if we're putting this tourniquet on and our patient has it for 2 hours, that means he already will start to receive permanent damage to that body part. And generally, it takes about 6 hours until the damage is complete, and he will definitely need an amputation. Again, this is not our choice, and we don't want to put our patient in such an extreme danger. We want to help him at the end of the day. However, in some situations, this tourniquet can be the only thing that will save him, and that is the benefit of these tourniquets. It can stop even extreme bleeding. Now, let's learn what are those situations where we have to use these things. Okay, so now let's go over the cases where we would want to put this thing on. Generally, we would want to put it when there is a major bleeding on our patient. That way we can know that this thing will stop it. Another situation is when there is an amputation, a full amputation or a partial amputation. Again, this is perfect for that. If our patient has a big bleeding fragment, we will not take out the fragment and we will just put a tourniquet on above it. But only if it's bleeding. If it's not bleeding, we will just leave it alone and not touch it. If we have multiple injured people or our patient has multiple injuries. And I want to explain this one really quickly. If there are multiple injured people, then we don't have time to put on bandages, and then if the bandage don't work, then to replace it and then put the tourniquet on. We would just put tourniquets on everyone. It's really fast, it's really effective, and we will know that it will stop the bleeding. Now, the reason why if he has multiple injuries is because, let's say I need 3 bandages on my arm. I need one bandage here, and another bandage here. Again, if even one of these bandages is not effective, then I would need to put a tourniquet on anyway. And with putting on this tourniquet, I'm stopping completely the bleeding from all injuries on my arm. So if we have multiple injuries, we would use a tourniquet. Another situation is when there is complete darkness. In complete darkness, if I have no flashlight or anything like that, I will not be able to see if I need a bandage or a tourniquet, and so I will just put a tourniquet. Another situation is if my patient has breathing problems. And lastly, if I try to put on direct pressure and it didn't work, then I will switch and I will put on a tourniquet. Okay, now that we know when to put these on, let's learn how to put these on. And there's a few things you need to remember about placing tourniquets on. Firstly, if you got to a situation where you need to use this thing, put it fast, okay? If he has an amputation or a major bleeding, he's losing blood quickly, and so we would also want to apply our tourniquets quickly and not take our time and wait too much with this. Another thing is that we want to put it 4 fingers above the injury. So if our patient has an injury here and we want to put it 4 fingers above, then I would want to place it here. Now remember, we would try to spare as much of his arm as we can. So I would always try to put it below joints if I can. However, we can't place this on joints. And so if we got to a situation where his injury is here and 4 fingers above the injury is exactly on the joint, then I have no other choice and I will place it above. Now, with most tourniquets, you would want to place them directly on the skin. They're not very effective if you put them on clothes, and so you will need to take your patient's clothes off to use tourniquets, except the best tourniquet there is, and that is the cat tourniquet. This one is the most quickest to apply. You can apply it on clothes as well, but it's also the most expensive one. So I really recommend having at least one of these in your first aid kit. After you apply these, make sure that you write the hour of placement. Okay, so you would want to write your name and the hour of placement. So the doctor, when your patient gets to the hospital, he will be able to understand how long this thing is on your patient, and that way he will know how to treat your patient. The reason why you're writing your name is that in case he has any questions or anything, they know who to contact. Also, after placing this, make sure that you check your patient's pulse. You want to make sure that the pulse completely stops. Now, if he has a complete amputation, then obviously don't check his pulse. In that case, just look and see if the bleeding has stopped. Also, after you place this, make sure that you check every couple of minutes to see that it worked and the bleeding didn't start again. And remember, this thing is extremely painful for your patient, and he will want you to remove this. After you place the tourniquet, you will never, ever, ever remove it. The thing is, when you open this up, then the blood, it builds pressure, and you don't want the bleeding to be even more severe. So after you put this on, you can't remove this. And lastly, if you put the tourniquet on and it didn't work, then you have no choice, and you will just need to put another tourniquet above the first one. You will not remove it, you will just put another one above it. Okay, now let's learn how to correctly place these things. Okay guys, now let's learn how to place the cat tourniquet. Now the cat tourniquet is probably the best tourniquet we can use, because not only you can put it above clothes, you can also put it everywhere. So even on the legs, even on the hands, everywhere. Obviously don't put it on the neck, guys, come on. Okay, so you want to take this and you want to put it 4 fingers above the injury. So if he had his injury here, I want to take 4 fingers and I want to place it exactly above. Now keep in mind, we would want to spare as much we can from his limb. So that means that I will always try to put it below joints if I can. However, I can never put it exactly on top of joints. And so if I have no choice and 4 fingers above is on his joint, then I will unfortunately need to put it above. Now again, ideally, after we put this, we will take this guy very fast to the hospital, and it doesn't matter if I put it above the joint, below the joint, or it just doesn't matter, because he got there fast enough to take it off. So 4 fingers above the injury, we want to place it. And the most important part, oh wait, first, you want to apply it into the first loop. I hope you can see it, into the first one. Now, the most important part when placing a tourniquet is actually when you pull on the start. So you want to pull as hard as you can right when you start putting it. So right now I'm pulling it as hard as I can, and then only then I'm starting to rotate this metal bar. Now keep in mind, when I rotate, if I pull this strong enough, I won't need to rotate this too many times. 1, 2, 3, 4 times would definitely be enough. If I'm rotating this 5, 6 times, I probably didn't yank it hard enough. After I rotated this, I want to place it inside this thing, and as well as place the rest of the tourniquet there. And I want to close it. Now, after I did that, I want to write the hour of placement as well as my name. Now, the reason for that is when we take him to the hospital, it's very important that the doctor will know how long has passed since we placed this. And the reason why we write our name is just in case, if they have some questions about this, then they will know who to ask. Okay, so this is how we put this. Now keep in mind, the reason why we're putting the rest of this string inside is because it's going to be very painful for him, and we don't want this thing to get open. Even if he wants to open it himself, we don't want that to happen. So we're gonna put this inside here. and we will not open it from the moment we have put it. It will stay exactly like it is. And if we need to put a different tourniquet, we will just place it above the first one. We have no choice. We will never open a tourniquet that we have placed. Now, I want to show you something, why the most important part was actually the pulling at the start. Look, if I place it, but I don't pull it strongly enough, so I just place it like this, like a normal person, then I can rotate this little metal bar again and again and again. And are you feeling anything?
No.
Okay, so you can just, I can even turn it again. I think now at like 4 times and you will feel something, but this is a waste of time. You can get to the exact same results very quickly if you just pull it strongly the first time. And this is how you place the cat tourniquet. Okay guys, now let's talk about the silicone or the rubber tourniquet. Now these tourniquets we can only put below clothes and we can only put it on thin body parts. So that means we can only put it on the arms and maybe the lower part of our legs. We definitely can't put this on thighs. Now the good part about this thing, however, is that it is very cheap. And so you can always have a few of these tourniquets laying around here and there, and at the end of the day, they are very effective. Okay, so now let's learn how to actually use them. Okay, so as we already know, we want to put this 4 fingers above the injury. So let's imagine his injury is here. We're gonna take 4 fingers, and that means I need to place the tourniquet right here. So how do you place it? The first thing you wanna do is you wanna draw a little line and make sure that it stops in the place where you want to place it. Then you wanna hold it with your finger, and you wanna draw a circle around his arm. Now, this is just a little circle where I'm not gonna pull it. I'm just gonna draw this circle very weakly around his hand. Now the reason for this is I want to capture this in place. Okay, so I'm not gonna pull it yet. But after I did 1 circle, then we can put some force on it, and then we need to pull it and then continue. And this is going to be painful for our friend, so we're gonna do this quickly. But what we're gonna do is we have to pull it really strongly and continue until we're finished with the whole thing. I'm sorry if this is painful. Okay, so I don't want to hurt him too much, so I'm gonna just wrap it around, but I think it's already working, right?
Yes, definitely.
Okay, sorry man. Okay, so after we finished doing the whole thing, we are left with some rope on the other side, on the other end, and we have the rope we left at the beginning. So now all we want to do is we want to tie them together. I recommend doing this 2 times so he will not be able to open it if it's too painful for him. Because remember, after we place this, we don't want to open it. So tie it 2 times strongly, and that's it. That's how you place the rubber or silicone tourniquet. Okay guys, and that is it for indirect pressure. Hopefully you now know how to put on tourniquets if you'll need to. Now, personally, I really recommend to practice how to put them. You can watch those videos 10, 15 times, but if you've never touched a tourniquet, then you will not know how to apply it correctly. So I really recommend that if you're buying tourniquets, that you will buy one for your first aid kit as well as one for practicing. And please don't think that I'm trying to promote anything. You don't have to use the affiliate links that I have at the end of this course. You can just go onto Amazon or whatever store you want and buy them for yourself. I'm only saying this because I really want you guys to practice, and I want you guys to know what to do in case you will need to do it. Okay, so that's it for this video. Hopefully you enjoyed, and I'll see you in the next one. Bye guys.